similar to yesterday, the um, the Black Lives Matter summit was met with the unexpected news of current events. And so, whereas this weekend saw yet another killing and murder of an of an unarmed black man, um, only 10 miles from where the Derek Chauvin case is currently happening. This morning, we woke to the news of the Johnson and Johnson vaccine, um, and you may have lots of questions about the news with regard to the CDC and is the Johnson and Johnson vaccine safe? So we want to start with what's happening right now, and we're lucky to have panelists who can speak to it. So this first question is for Dr. Clayborne. Could you talk a little bit about this breaking news? And first of all, what was said and what should we think about it?
Sure. Thank you, Dr. Hendrickson, for having me. I'm really thrilled to be here. I think this is a wonderful event. And as an emergency physician, I think that I have a unique perspective of the entire pandemic and fortunate enough to have access to breaking news. So I was surprised, like everyone else, when there was a press release this morning that talked about how both the FDA and CDC are essentially pausing on the rollout of the Johnson and Johnson vaccine due to a small number of adverse side effects that occurred in six different individuals. And what I first want to say is you want to give this information some context. So these complications were clotting related. They all occurred in women ages about 18 to 48 who had low platelets. So it's a specific population they think is at risk. But we're talking about six people out of the 6.8 plus million people that have actually received the J&J vaccine. So it is actually a very small number. And what I think that speaks to is that I do believe that our health officials in our government are really trying to be transparent when it comes to giving us real-time information and making decisions that are overly cautious as we move forward with the rollout of these vaccines. I also want to call to people's attention that the vast majority of vaccines that are taking place at a daily basis are the Pfizer and Moderna vaccines. So J&J is actually 5% or less of the vaccines that are being administered at this time. And so I think what you should take away from that is that this should not adversely affect our goals of vaccinating the majority of people by the summer months in the United States. Now, there are a lot of other implications that we really don't know at this time. And so I think that there are some fears for people who maybe recently got the Johnson& Johnson vaccine. And so, certainly like any other injection or vaccination that you should get, you always want to pay attention to your body. And if you are having signs and symptoms of an adverse reaction like chest pain or shortness of breath or dizziness, you would want to seek medical assistance. But that's not to conflate those more serious adverse outcomes with side effects that most people may experience when getting a vaccination. And those relate more to like body aches, headaches, fatigue, or just generally feeling unwell for a few days. And so while it is discouraging, right, that we have one of the vaccines that everyone was trying to say was safe and a good option, a one-shot option, and that's now off the table, I still want to remind people that the COVID vaccine coming from Moderna and Pfizer still has very strong data. It is the majority of the vaccines that are being rolled out. And I would encourage everyone to still pursue getting a vaccine appointment with stand. They are currently now in the process of basically rescheduling everyone who was going to get a J&J vaccine to get one of the other two vaccines. And we feel confident, I think, with the supply that we have, that everyone should have access to those two until we figure out what's happening. And, this is going to be an evolving story. I mean, that's the preliminary data we have now, but six people out of over 6 million is a very small number. So please just bear that in mind. And I wouldn't want you to panic and think that there's a problem with all of the vaccines. I think that actually it may bear out that these are individuals that had other things going on, and this was just an adverse outcome that is isolated to a very small number of people.
Thank you. And Dr. Bim, did you want to follow up? We earlier in our prep in earlier conversation, we talked about the phrase abundance of caution. Um, which is the rationale that's been used. Can you talk a little bit about the abundance of caution based also of what Dr. Clayborne just said?
Right. I definitely second Dr. Claiborne's assessment and um, think that the takeaway here is that the system is working how it should be, and our government and regulating bodies are doing, what they can to make sure that the vaccines are safe. Even going as far as to pause, uh, because of 6 instances out of 6.8 million. So I think people should really take away that things are working really well in terms of making sure that the vaccines are safe and effective. So definitely agree with Dr. Clayborne's assessment there. And I'm happy to see that the FDA and CDC are doing this to show people that they are not trying to rush things through, that they want to be careful and cautious.
Thank you. And Professor Armstrong, you've had a personal experience with this as well. I'm actually curious about each of your statuses with regard to the vaccine. Would you mind talking about that for a moment? You're on mute.
I'm so sorry. Yeah, so thank you for having me. I appreciate it and being among such expert panelists here. So my experience was the fact that I honestly have to be very open and honest. I was hesitant to take the vaccine because again, mistrust, misinformation. Although I'm a registered nurse and I'm exposed in my work field and with students and patients, I still was hesitant to take the vaccine. My mom, who is in her 80s, and my brother and all of them in their 50s, 60s refused to do it. Again, it's because of the trust. They do not have the trust. I will talk a little more about that later on, but the trust about government, the trust about is there a reason about, is the vaccine already secured? Was there enough information? Did they have enough years to prepare that? What were the studies and all of that stuff? I think it's just misinformation. And as Dr. Claiborne already spoke about that, the message has to be delivered, right? I think it's all about the delivery of the message and the information. And so with me, I was a little hesitant. However, I took the vaccine on Friday. I took the J&J vaccine on Friday with my daughter. Do I feel better? I would have to say yes. Do I feel a little more secure? I can't believe I'm saying that, but yes, I actually feel that it was the right decision that I made. But by doing that, though, I did not just do that. I actually researched a lot. I read a lot, and I made sure that this was what I truly wanted. But it's not about just me, but taking the message across. So I spoke to my mom, I spoke to family members, I reached out to friends in the community, and I encouraged them to do the same thing that I did. So for me, as opposed to others, I was definitely more hesitant. And but I did go ahead and I took the vaccine, and I would encourage everyone to do the same. And like Dr. Claiborne said, the stats are there, the research is there, the numbers are there, and we just shouldn't panic about it. So my experience was that I'm happy that I did, and I believe that my mom is actually thinking about doing that in my family. So hopefully, I think a change is coming, and it's going to be a great one. Thank you.
Oh, thank you. Dr. Bihm or Dr. Claiborne, do you have a personal story? How does this relate to you?
Sorry, I was on mute. We were going to discuss this a little later, but I had a very scary 2020. I was heavily pregnant when the pandemic hit. I worked in the ER on the front lines through the first wave when a vaccine was not even in sight. I was fortunate enough to deliver a healthy baby girl in May of last year, and then I came back to work and have been kind of on the front lines since then. And I received the Pfizer vaccine. I was one of the very first groups to be vaccinated, and grateful, right, for the really amazing science that was like able to be produced to bring the world a solution that gave me a shield of protection, because every day I was going into work afraid that I was going to bring home something that was going to kill
Yeah.
my infant daughter or my toddler or get my parents sick who were helping me. And so I had an extreme sense of relief when I finished the Pfizer vaccine in early January. And then I have been breastfeeding my daughter since then. And so I also can speak to how comforting it is to find out that the data is now showing that the vaccine has also allowed me to pass protective antibodies to my daughter. And so, this is something that I deal with every day because of the nature of my work. But I do encourage people to, ask the questions that's going to make you feel comfortable. I'm not telling you to just do it because I did, but, find someone that you trust. So, if you think me as an African American physician that deals with this every day and have pronounced people dead on more occasions than I care to count from COVID, is telling you that this is a good idea, then, I hope you listen to me. But if you need more information, then seek that out and get the information you need to answer this question, because it is something that will adversely impact our people of color in particular in a detrimental way that is disproportionate from the rest of the country, to be honest. And so I'm very passionate about encouraging other people of color to get vaccinated, especially our mom and breastfeeding mothers.
Thank you. And speaking of the issues that were just raised, we talked a little bit about trust, and Dr. Clayborne made it clear that this is something that has disproportionately affected Black communities, communities of color, and I want to dig a little bit into that and shift our conversation a little bit. As you know, communities of color are less likely to view the vaccination for COVID-19 as favorably. Studies have shown this, and many have blamed this, particularly for Black communities. Many have traced this back to the Tuskegee syphilis study, although scholars have dismissed that as a major factor in Black communities' hesitation. Can you explain what are the major causes of this hesitation and why it's important from a public health point of view to address and understand them? Dr. Bim?
Yes, thanks. And I didn't get to say thank you earlier for having me. It's really nice to join you and the panel here this evening. It's kind of like a homecoming of sorts. And all opinions expressed are my own, even though I do work for a local health department and those two universities that Jason indicated. Just wanted to put that disclaimer out there too. Okay, so in terms of your question, I just want to start off by saying that a growing share of Americans do say that they will get the vaccine or already have, according to some recent data from the Pew Research Center that came out in March. So a majority of Black folks, about 61%, now say that they plan to get the COVID-19 vaccine or already have received one. That's up about 20% from November, when about 42% of Blacks said that they would get the vaccine. So I think as time goes on and more information is shared about the vaccines, such as the information that Dr. Clayborne shared, people are feeling a little bit more comfortable about getting it. There's still some differences in the intention to get vaccinated amongst people of color, but generally those are smaller now as the time goes on, like I mentioned. So in terms of some of the reasons why some people in our communities are feeling reluctant to get the shot, we have concerns about side effects, that the vaccine was developed too quickly. Many say they don't trust the government. These are all valid concerns. But I think it's really important when we talk about reluctance or hesitation to talk a bit more about regular interaction with the healthcare system. And how people may not necessarily be getting that regular interaction through their annual checkups and visits for preventative services. So there's an element here of health-seeking behavior that is really important to keep in mind when we think about this overall reluctance and hesitation. So just a couple of important data points here to give us a better picture of individuals' interaction with the healthcare system. in New York State, amongst adults, about 20% of Hispanic individuals reported that in the last 12 months that they didn't seek out care from a doctor because of cost. Okay, 20%. 12.2% of Blacks said that they didn't do that. They didn't seek out medical care from a provider in the last 12 months because of cost. For the whole state, it's about 11%. So there's differences here. If you're not already sort of interacting with a primary care provider, you're probably less likely to go get a new vaccine, right? If you don't have that regular interaction and don't get that information from that provider about why this is helpful and important. Another thing to keep in mind, amongst adults in New York State, about 37% of Hispanic adults in New York State reported that over the last 12 months, they didn't have an individual that served as a personal doctor or healthcare provider. Almost 40%, and for Blacks, it's 18.9%, almost 20% say that they don't have a healthcare provider. I think these are some of the really important underlying sort of issues around hesitancy and reluctance that we need to focus on that existed prior to COVID. COVID has only exacerbated this sort of non-regular interaction with primary care that is becoming really sort of important and coming to the forefront now. And so I just wanted to sort of put that out there that if you're not regularly interacting with primary care or primary care professionals, you know, it's kind of hard to then just make that leap with this vaccine coming out to just go and sign up and get it. And so I think it's important to keep those things in mind.
Thank you for that, and you know, really excellent and important points. Professor Armstrong, you have an important perspective as well from the nursing angle. Would you mind sharing a little bit of your perspective in terms of why race matters so much in this conversation and your own experiences? And make sure you unmute.
So sorry. Again, I have to say I'm happy that Dr. Bihm put out all the numbers because because she made my life so much easier. But yes, so as a nurse, what we kind of notice a lot with our patients is exactly what Dr. Bihm spoke on. Resources, not going to the doctor and all of that, you know, it's just one of the many, many things that I've noticed, even when we do home care nursing or any of in the clinics, the only thing we always get, they don't have insurance, they don't have the resources to eat properly and all of that stuff, pay the medications, they're undertreated and so forth. However, before I could even address that, I just wanted to talk about, yes, we know about the Tuskegee syphilis study. We know about that. We know about the fact that even though there was antibiotic penicillin, they would not offer it to the guys, the men of color. We know about the Henrietta Lacks that I want to touch on because she was the one that had the cervical cancer at Johns Hopkins, and they use her cells and they use it for science and all that stuff. And decades later, it's still being done. And then the family members did not know about that, nor did they have consent of it until about 20 years after she died. They knew that they were experimenting on her cells and so forth. You know, it's a lot about the trust that people of color have. And so, yes, sometimes we get a little frustrated, but we also have to really understand and put ourselves in a time and space as to where those individuals are. And we have to meet them there, okay? For me, as a nurse with sickle cell anemia, I'm a sickle cell trait person. I have my patients, my children have it. So even something like sickle cell, I'm going to present you or propose a question to all of you, and even all those who is listening right now. How many commercials have you seen about sickle cell anemia? How many? Just think about it. How many commercials? Is that being promoted? Any commercials on that? Who does it affect? It affects people of color and Hispanics and minorities. And so there's a lack of research in a lot of those patients with sickle cell, and they are undertreated. Why? Because if government and with the resources and the monies that's put into that, they do not have it. And physicians, because of all the regulations, they cannot provide the patients with the adequate treatment for the pain. I will share my personal experience when I work with my students. I'm not going to, of course, give exactly where, but I've worked with students and I'm taking care of sicklers in the hospitals, on the floors, in the units. And there was one patient that was 27 years old that just struck me. And this young lady was just in extreme pain and she was horrible. She already had a couple of severe strokes. And I'm taking care of her and it just bothered me. And I looked at her and I said, what is going on? And I eventually spoke to the doctors and I got everybody involved. To make a long story short, eventually they had to change her pain management schedule. They took care of it. And after that, I looked at her the next day or two, I think it was. She looked like a whole different person. And she looked at me and she said, Nurse, just thank you for listening, because apparently nobody hears or believe us as sicklers. What do they see? They see us as drug addicts. They would test me to be whether I'm on drugs or whether I take drugs and so forth, right? So again, I understand all of that. I get the fear and I get the anxiety, but we also have to understand where is that coming from. And so the message has to be, the messenger has to deliver that message to the people. They have to deliver that message to the communities. And so I'm so happy to see Dr. Bihm and Dr. Clayborne actually talking and sharing their expertise, because now they're going to reach out to those people that are hesitant. But you have to understand that these people are suffering and they're going through it. They have their own belief system. And that's what I think is the cause of the hesitancy of the vaccinations. Yeah.
Thank you for that thorough answer. Very much so. Dr. Clayborne, my next question is to you, but you also have quite a background in this area as well. So is there anything you wanted to add?
The only thing that I'll say that I when people bring up Tuskegee and Henrietta Lacks, that I like people to remind themselves that, in 2020, the biggest thing that we have on our side is visibility, right? We have social media, we have visibility. That's why Black Lives Matter happened, right? Like, this used to happen with police brutality for the entire history of this country, even worse, right? The only reason it's come to light is because people can record things on their phone and make it public. That's true in healthcare too. And so you have to remember, like, there are not secret experiments taking place behind closed doors. That is why you're seeing these press releases about J&J happen in real time. There has to be real transparency. And I want to remind everyone that the trials that were done on Pfizer and Moderna did include African Americans, about 10% in each, which is reflective of our percentage of population in the United States. And so we were not left out of that research. That's actually what happens most of the time. So if you are considering the vaccine and you're hesitant, I want you to ask yourself, why are rich white people trying to get this vaccine? Like, why are they, trying to jump in line to get something? Like, to be honest, the conversation should also be directed towards access, right? I think the other side of the coin of vaccine hesitancy is talking about access, which is a lot of what Dr. Bihm was talking about, right? We need to speak to, like, where are these vaccines available? Are they going into church centers? Are they going into community centers to make it easy for communities of color to get that? If you ask me, we are actually, because of our disproportionate in adverse outcomes and deaths from COVID, we should be higher on the list, right? We should be prioritized to get the vaccines first and make it easier. And I do think the government has been working towards that. They have some particular programs that are focused on that, but you're going to have to advocate for yourself and your community as well. And so, finding out where you can get vaccinated, where you can help someone who doesn't have access to technology is important. And remember that, in 2020, your story matters, your voice can be heard, so use it.
Thank you. I'm slightly chuckling because uh, in my class am teaching or about to teach about research. You made the point about about, well, you have rich white folks getting this, and one of the ways to debunk conspiracy theories are, well, are the people in power doing the same thing? That being said, um, there are a lot of issues of access and politics that we can get into, but I also want to get some very clear information out there. We're in the middle of a pandemic still. We're up to this point, we've been talking about vaccines, yet we still have uh, the coronavirus running rampant. Still, numbers are not where they should be. Um, since we have this collection of experts, Dr. Clayborne, I'm going to start with you. What is a myth about the virus, not the vaccine, but a myth about the virus that you would like to see eliminated?
Mhm. So I just want to remind people that, my experience is coming from taking care of actual COVID patients every day when I go to work. I work in PG County, which is just outside of Washington, D.C. It's a largely African American Black population that I take care of. And I have seen very sick people. And what I would like to emphasize about COVID is it is not just the flu, right? The flu can kill you too. That is why we have the flu vaccine. But COVID, I believe, now that we're looking back at 2020, was third in all cause mortality and death last year. So, it is significant for a new entity that did not exist the year before to come in and be a leading cause of death, and even more so in communities of color. And so I want people to still understand that when you're making a decision about vaccinating, your decision should be, do I believe that I should take my chances with the virus or the vaccine? And the virus is dangerous. Now, if you are younger and you don't have comorbidities, you might be okay, but that's not guaranteed. I have had very sick people who were my age in their 30s that had to be intubated, being placed on a breathing machine. And it is hard to say, who's going to do okay and who's not. And I just don't think it's worth that risk. So, one of the biggest myths I'd like to dispel is that it's not that big of a deal. If you get it, you'll be fine, because that's not the case. And the data is like bearing that out now that we're looking back. It is still very dangerous. And you have to also remember that it could continue to mutate, right? I think that there has been some information about the mutations. That is why we're working so hard to vaccinate, because we're working against time, right? Like all viruses mutate. And if there is a mutation that emerges that has some resistance to this vaccine and becomes a dominant strand, that could put us in a very difficult situation. And so I want people to stay vigilant. It's like we've been running a marathon for this last year. And while we are close to the end, we are not there yet. So it is still important to mask up, to socially distance, to not travel unless you have been vaccinated and you're taking or you're taking the right precautions, because that risk still exists. It's still there. We're not quite out of the woods, and we're so close. So I just want to, encourage people to just buckle down for these next few months till we get our vaccination numbers up to date, and not to play games with COVID.
Thank you. Would either of you, Professor Armstrong or Dr. Bihm, want to add to that?
I think Dr. Claiborne answered it perfectly. I think the virus just believed that it's real. I just hate to hear people go around saying this is not real. It's just a man-made thing, and there's, So I think that's the myth I would really like to see just be eliminated. But exactly what Dr. Claiborne said, I totally agree with her.
Just to add one more note, I agree with both of Dr. Clayborne and Professor Armstrong, and to their points that small gatherings don't spread COVID. That's a myth. Small gatherings still have the potential to spread COVID. And so just like it was already mentioned, we have to keep social distancing. We have to keep wearing masks. Children are still going around unvaccinated. And so we just have to bear down to the end. We're hopefully almost there.
Yeah, thank you. And to speak personally, it is not a myth. I had it. I lost my sense of taste for a month. And, these are things that are real. That being said, now that we have talked about the virus, what is a myth about the vaccine that you would like to see eliminated in terms of misinformation? Anyone want to start and tackle that one? I'll direct that to Dr. Clayborne.
Yeah, so we talked a lot about the J&J vaccine today and the other ones. One thing that I think is important to emphasize is the two vaccines that we're going to be focused on now, because they put a pause on J&J, is that they're both mRNA vaccines. And if you haven't done research on what these are, it's worth looking into. It is a different way of vaccinating than we have traditionally seen in the past, where you might be given an inactive or part of a virus, and people are afraid they can get the virus from the vaccine. That is not the case whatsoever with these mRNA vaccines. All it is giving you is basically a roadmap to code one part of the vaccine that helps the virus enter your cells, and it blocks that. And so it is very efficient and effective in the way that it protects us. And this did not get born overnight. We actually have been working on mRNA vaccines for years since we've had the SARS pandemic. And so that's another misnomer about the vaccine, that we had this warp speed thing. They came up with these new things and it was pushed too fast and we don't know what we're doing. No, they have actually been doing research on mRNA vaccines for years. It was just, I guess, fortunate, if you think about it, that they had that primer of that kind of vaccine that works in that way, and were able to adapt it to work specifically for the coronavirus. And so these vaccines have lower side effect profiles from typical vaccines. We're getting new data out of our pregnancy registries about how they can be very effective in protecting unborn infants and children who are being breastfed. And so I do think that when we're looking at the safety profile of these vaccines, in particular Pfizer and Moderna, they're very safe and they're very effective. I think as we get more data, and you always want to keep yourself up to date, we'll learn more about why they've been so effective. One of the things that they're discovering now, that they're comparing people who had natural immunity from getting COVID. So like Dr. Hendrickson got COVID, and so he has hopefully some immunity that his body generated from that. They actually think the vaccine has a more robust reaction than just getting COVID, which is why we encourage people to be vaccinated even if they got COVID. So I am just a big proponent of like getting more information and learning about the vaccines as it unfolds. It is something that we're learning about in real time, but there is a long-standing history of data about mRNA vaccines that have demonstrated why they're safe and effective, and that includes the ones that are directed towards COVID.
Thank you very much for that very informative answer. Dr. Bihm or Professor Armstrong, anything that you would want to add to that, Professor Armstrong?
Very simple about the vaccine. Please do not believe in all the noise that we hear that the vaccine is there to, there's a chip that's placed in the vaccine and it's to eradicate certain groups of people or different races. And I hear that. I'm actually hearing these conversations that I'm not taking the vaccine because they put a chip in there, because they're trying to get rid of us, they're trying to execute this, and they want to get rid of. So please, if you can just, just like Dr. Clayborne, Dr. Bihm said, pay attention, read, do your own research, and please know that this is definitely not true. These are untruths. And my personal note, I did lose a lot of family members due to COVID last year. So 2020 was hideous for me. I lost my aunts, my cousins for COVID-19. So it's real. And now that we have a vaccine, please be brave, be smart, and do it. So thank you.
And that the best vaccine to get is the one that you can get an appointment for now. So just get it if you can. Don't hold off if you have an opportunity that presents itself to get the vaccine now. Try to get it.
All right, thank you all. Before we get into Q&A, I do have one final question before I turn the program over to my colleague who will field questions. So if you do have questions, please put them in the Q&A if you haven't already. And I see some good ones that we will have time for. But I also want to pose this question to the panel. This is with regard to, not just yourself, but your community. And many of our students are also parents. They're also caregivers to elders. What should parents of young ones and caregivers what should parents of young ones and caregivers to elders be considering at this time? what does the research say regarding vaccines in adolescents? Can we just talk a little bit about um, that experience that parents may be having with their children, particularly with young children? And Dr. Clayborne, you talked about this a little bit earlier, so I actually want to start with you.
Yeah, so we're, as you guys know, there's trial going on right now to see if we're going to get FDA approval for the vaccines in children as young as 12. So that's really targeting the adolescent population, which we think are the population that are the most likely to be kind of spreaders of the virus. We're still getting data. Fortunately, this virus doesn't seem to have a huge impact negatively on children. You guys can imagine what a pandemic would look like that hugely impacted children adversely. That is a possibility in the future. That's why we need to learn from this pandemic moving forward how to do better. But so far, younger children seem not to either get the virus very easily or spread it. Now, we're still researching why, and I do think eventually they'll have trials to vaccinate all children of all ages, but they're focusing on adolescents because that's the group that we think are at higher risk for both being infected and potentially spreading. And as you know, adolescents interact with a lot more people, whereas younger people might, younger children are probably more home-based and not as good, likely to be super spreaders. So I do think that parents need to look at when that's going to be available. Right now, who are you going to be turning to get your kid vaccinated? So start talking to your pediatrician, ask them, see what resources there's going to be in the community center, see what the school policy is going to be as far as getting a vaccine, and prepare yourself. The other thing I always emphasize that everyone of every age should do is to get an advanced care plan. People always ask me as an ER doc, like, what should I be doing, Dr. Clayborne, and what should I be paying attention to? No one who I've taken care of that I'm about to put a breathing tube in or do CPR on thought that they were going to die that day or come close to death. And so when that happens, it's too late for you to have told me, what you want at the end of your life or who to talk to or what your medical conditions are. And so right now you should be documenting all that and putting it in what's called an advance directive. That's what my TED talk was about. If you want to learn more about it, I encourage you to look that up. You can just Google my name, Elizabeth Clayborne, and TEDx. It will come up. And you should look at having a conversation with your family, your parents, whoever it is going to be your medical decision maker, or who you might be a medical decision maker for, and make sure that everyone's on the same page, that you have up-to-date information about them, and that a doctor like me can have access to that if there's an emergency, because you do not want to put your children in a situation where your voice isn't being heard, or they don't have the ability to answer questions that they've never thought about before. So I think it's important for all age groups, but especially people who are taking care of older people or people that have kids that, will be put in a difficult situation if they became sick.
Thank you. And you're not the only mother here on this panel. You did mention earlier, I believe we talked a little bit about care of a young one. You're a recent mother. Um, and Dr. Bihm, you are also a mother. Anything you want to follow up on regarding?
Yeah, thanks. Dr. Clayborne, again, sort of really succinctly provided that information regarding children and the importance of planning ahead, right? We don't want to think of our kids in these situations, but unfortunately we have to. I wanted to add a little bit more about, and Dr. Clayborne touched on it earlier, pregnant women and women who are breastfeeding, and just how the emerging data on those groups of women who had to, because of their line of work, perhaps in healthcare, like Dr. Clayborne, had to strongly consider getting vaccinated as soon as that was a possibility. That preliminary data is just really promising in terms of showing that antibodies are also passed along to the newborns. And that's really important in the sense that newborns, come out with sort of a not as strong immune system. So the fact that through the placenta, the babies are able to get this immunity conferred to them is something to really strongly consider if you're debating getting the vaccine while pregnant or soon after when you're lactating, if you do plan to breastfeed. So I just wanted to point that out there, that, that data came out a couple of weeks ago through a study that Massachusetts General Hospital and Harvard worked on to sort of assess these pregnant and lactating women. And in terms of, adverse outcomes in pregnancy, so like miscarriage and pregnancy complications like diabetes and preeclampsia and preterm birth, the rates of those amongst individuals, who are not vaccinated, they're just regular individuals giving birth, is comparable to the ones who've gotten vaccinated. So that's also something important to keep in mind. Like the rates of these adverse reactions are similar between the vaccinated and unvaccinated group. So if you're sort of on the fence and considering if you're a pregnant woman or a lactating woman, those are some promising pieces of information to keep in mind when you're trying to make your decision.
Thank you. And I want to move to the Q&A section because a bunch of really important questions just came in the chat, folks who are looking for direct answers. And so we're going to shift to that portion. We may go a few minutes over and try to get to as many questions as we can. And here to moderate the Q&A will be our own Dr. Sultan Jenkins. Dr. Jenkins, please take us through, and panelists, feel free to be as specific and concise as possible because folks are asking some pretty direct questions that hopefully you can help them with.
All right. Hello. Good evening, everyone. So the first question I'm going to ask is from an anonymous attendee. If we have access to both vaccines, how should we choose between Moderna and Pfizer?
We've said this a couple of times. Moderna and Pfizer are essentially equivalent. They have equivalent efficacy, equivalent safety profile. So one of the appointments is going to be first, and so your selection should be whatever that appointment is that's first. That's what I would recommend, is wherever you can get in first, that's where you should go when choosing between those two.
Okay. So the next question is more of a, I guess, personal question from Dima. So she's been working with students that have been experiencing anxiety and division between family members. Some family members are getting vaccinated while other family members are against the vaccination. So she asked, what advice can we give students who are navigating these divides and differences within the family, especially during a time when students already feel socially isolated, separated from family and friends?
I have to chime in on this one. I'm a doctorally trained public health professional, yet within my family and among my parents, there are still differences in views on getting the vaccine. And I struggle sometimes to communicate the importance and safety of the vaccine. So I understand this conflict and struggle. And sympathize with it greatly. I think the best thing you can do is continue to talk about the information that is available, just like Dr. Clayborne mentioned, talking about the efficacy. So how effective is the vaccine, and emphasizing that this vaccine promises to protect against COVID illness 95% of the time. That's a lot. When you think about the flu vaccine, and I think the most recent flu vaccine season, 2019-20 season, the efficacy of that vaccine was about 50%. So just to get some more context on how powerful the Pfizer and Moderna vaccines are, they're really effective. And just sort of weighing that against, and potential side effects, having a fever for a day or two maybe, or having some fatigue, weighing that against being on a ventilator. And we have the ER doctor here to attest to that. I hate to, be so graphic and bring it to that, but I've had to say that to my family members. I understand that having a fever and being fatigued is a little bit of an inconvenience, but being on a ventilator and dying is more inconvenient. So that's my personal advice. I would mince my words a little on the professional note, but we're here to be honest, right?
Right.
So, yeah.
That's a very true answer. So next question, are we still protected from the mutated version of COVID-19 if we have been vaccinated for a different strain?
So there's a question about people have probably heard about variants coming out of Brazil, South Africa, and UK. Are the main ones. And so far, the data is showing us that the current vaccines that we have been protective against these variants. It's hard to know what particular variant of COVID you might get, right? Because we're not genetically profiling everyone who gets tested. But in general, the data is showing that we are being protected against variants. That's not guaranteed in the future. The virus continues to mutate. And so it's possible it could spin off a mutation that is not protected by the virus. And that is why we are working so hard to get everyone vaccinated, because the more people that are vaccinated, it will suppress the ability of that virus to continue to mutate and then kind of emerge with a dominant strain that is more dangerous. But so far, the data is showing that the vaccines that we have are protective against the variants that we are seeing predominantly in the United States and around the world.
Okay. Next question is, can you talk about if achieving herd immunity is in fact achievable in the near future, like this year? Listening to another COVID discussion, a panelist said getting to herd immunity is like chasing a magical unicorn.
I can take a shot at that one again. I do think that so herd immunity, for people who aren't familiar with the term, is basically what we try to achieve with a lot of other diseases that we vaccinate against, right? We get a majority, they're thinking the numbers have been very nebulous. We're not going to have a precise number, maybe somewhere between 75 to 80% of the population, maybe 85% of the population that need to be vaccinated, so that they're basically, we're not seeing the virus emerge and having control over new infections that we're seeing in the country. Now, 75 to 85% of the United States is a lot of people. That's a lot of people to vaccinate. But right now we're vaccinating about 3 million a day. And even taking J&J out of the picture, we are on track to potentially reach those numbers this year. And so I do think that we could get herd immunity. Now, the reason there might be a conversation about that chasing a magical unicorn is because there are questions about how long does the vaccine last? Are we going to have to get boosters in the future? And we're hopeful that that's not the case, but that's not a guarantee. And so I think that's where that question comes up, that, we're never going to reach herd immunity. I don't necessarily agree with that. That's not what the data is showing us. So far, people have been having good, strong immune responses over a long period of time, but it's difficult to tell. To be frank, though, it doesn't really matter. Like right now, you need to get vaccinated. Like, we need to try. There is a possibility if we get vaccinated that we could get to this point where it's under control and it's not going to be something like the flu where we have to get boosters every year. But there is a possibility that, this is something that we're going to see in the future and have to have continual vaccinations for. It's too early to really tell what the long-term implications are. And to be honest, I don't think that they matter as much. What matters right now is that we get control of the current pandemic and that we get these numbers down so that we are having very isolated cases of new infections in the future. And the only way to do that is to keep vaccinating and get as many people vaccinated as possible.
Okay, thank you. Next question, it's kind of verbose. It's from Wendy. She says her doctoral research is about the stress and trauma of racial battle fatigue in Black females in higher ed. And a theme that continues to arise is the connection between healthcare and racial battle fatigue. Given how the Black community is disproportionately affected by COVID, do you believe that Black women are more susceptible to the virus and more seriously affected by it because of the impact of racial battle fatigue?
I honestly cannot, I did not see any research. However, I did read a few articles just recently, and it stated that women of color tend to become, I think, they become sicker, or they show more of the symptoms as opposed to male. And they were saying that it's because of the stress and the stress that causes that. I do not have any data on that, but I did hear that before. I'm not sure if Dr. Clayborne or Dr. Bihm heard, but I know I heard that just recently. I think about a week ago. I think I actually heard that on CNN or ABC, and I read an article on that, and it says that women of color, due to stress and hormones and so forth, that is true. But I do not have the data on that at all. I'm not sure if any one of you do.
Yeah, so I don't have the exact data either. However, I do know that stress does have a significant impact on not only women's health, but all of our health. You know, there's sort of longstanding systemic health and social inequities that put our communities of women, men, adolescents at increased risk for getting sick, and then in particular getting sick and dying from COVID. Some of these factors which people refer to sort of as social determinants of health have historically prevented us from having a lot of fair opportunities for economic, physical, and emotional health, and that wears on us over time. Social determinants of health for the uninitiated are conditions in places where people live, where they work and play that affect different health and quality of life factors. So I'll give an example. This is kind of just a general story or scenario. Many of us have grown up in families where our parents had limited educational opportunities. They may have worked many hours and still struggled to support the family. We may have then been raised in communities and gone to schools with less resources. This may have left us not as prepared for the best educational opportunities after high school, leading to jobs in which we have limited control, working long hours to struggle to live, just to pay rent, and pay rent for apartments that need a lot of maintenance, feed our families, try to keep them healthy and keep ourselves healthy. So therein lies the struggle, right? We have all this burden to carry. If you make $12 an hour, and I love using this example, it's horrible, but if you make $12 an hour, it's hard to even think about paying $12 for a salad when you have several mouths to feed, right? And so you may choose the more affordable option that's less healthy because you need to do what you need to do to survive, right? And so you may be sort of inadvertently damaging your health by eating these more affordable but less healthy options. And then on top of that, some of us may not have access to health insurance through our employers, or we may not have the time to take off of work to go to the doctor, or money to pay for a copay for a visit. So, you know, that's kind of a picture of how poverty and education and housing and jobs and lack of access to healthcare can all have a significant impact on our health and our quality of life, and thereby increase our risk for chronic issues such as high blood pressure and diabetes and such. Some of the things you mentioned affecting women in particular. And so on top of all that, many of us also encounter racism, right? So we're talking about these opportunities that sort of already set ourselves up to be not as healthy as possible. Then another social determinant is racism. So recently, these police brutality incidents and the disproportionate impact of COVID-19 on our communities have helped to sort of unearth this problem of racism that we all know is not new, but it's brought it to the forefront of you know, the nation and the nation's attention, which is really important and some progress. Just in the past year, the American Public Health Association, the American Medical Association, and the Centers for Disease Control have all declared racism a public health crisis or a threat. And many of those institutions have also put forth recommendations for governments and organizations to implement policies to help combat racism. And so that's important in sort of going back to the question, all this, you know, the social determinants of health, racism, weigh on us, regardless of educational attainment, sometimes even more so perhaps for people maybe in positions of high stress And so I will say that it's great that we're sort of bringing more attention and in talks like this to the importance of Black lives and why this is a public health issue. And so we're going somewhere and making some progress, and hopefully with this increased recognition, we can continue to make that progress.
Okay, I guess this probably be the last question. So this question is for all the panelists. Karen asks, now that you're vaccinated, how are you all responding in terms of your behavior? To what degree are you, in quotes, getting back out in the world?
So good question, because I think it's important to bring up that even after you get vaccinated, everyone is still encouraging people to still be safe when it comes to social distancing and mask wearing in public places. So I don't do anything different at work. I still have to fully gear up in PPE for every patient that I'm, going in to see. I feel more comfortable. I feel more protected, but 95% or 96% is not 100%, right? And so it is not a guarantee that I still can't get sick. And so I still conduct myself as such. That said, now that my parents are vaccinated, I'm vaccinated, I have 2 small children at home, I do rely on them more to come over and help me. I feel more comfortable with them being around me. They actually stuck by me through the pandemic before they were vaccinated, but I was hesitant to do that because of my exposure risk. And now I feel much more comfortable within my intimate family setting doing that. And so the recommendations from the CDC are that people who have been vaccinated can go around other vaccinated people and have a meal or be in a space without a mask. But this is not a large gathering, right? We're not talking about having parties, and we're not talking about being in public places. In public places, you still should wear a mask. And you just have to remember, again, like being a vaccine is not a bulletproof vest, okay? You still can get sick. And you also, there are still potential variants that are circulating that are new that we don't know about. And so you don't want to expose yourself to that until we have a much better handle on the pandemic. And so I would encourage you to still kind of get vaccinated, but keep your behavior in check. Keep doing those things to protect yourself.
Thank you for that. Because there are a lot of questions in the chat, I'm going to ask my panelists if we could be gracious enough to spend a few more minutes. Is that okay?
Sure.
A few more minutes on
sure.
them, and all of you are professors as well. So I'm going to challenge you to be concise. Will be like a game show round, quick hits. So the next few questions, we'll see if you can just as quickly as possible provide some clarity. Dr. Jenkins, do you have one?
Yeah, I have still like 9 in the chat room, in the question box. So, so someone wants to ask 2 questions. What encouragement do you give someone? Sorry, I'm just reading what's on the screen. Who has asthma and would like to take the vaccine, are worried about the side effect or get sick? Then which one is safer to take? Yeah, so those are the 2 questions.
I'm going to let Dr. Clayborne talk about the part of that question. But for me personally, I have asthma. I was very concerned about my daughter, who is allergic to peanuts and has a lot of terrible allergies. And so I was definitely afraid that whether or not she should take the vaccine. However, clearly evidence has showed and the research has showed that allergies and so forth, it's okay to take the vaccine even if you have asthma or you have any sorts of allergies. Of course, if please speak to your doctor, if it's a child, speak to your pediatrician, speak to your healthcare provider. But for me personally and for my daughter, it was fine. As opposed to the side effects, my daughter got a very high temperatures. She had a lot of chills, but it didn't last more than 24 hours. And Dr. Clayborne spoke a lot about that, the side effects, the sight and so forth. So I think please just stay calm, be mindful, get vaccinated, please. Whether you have allergies, you have asthma, whatever, please get vaccinated. It really comes to which one you prefer, dying or just having a life. And so for me, I think that was a decision I made for my daughter and for myself.
Okay. Um, a friend was worried that the vaccine might cause increased autoimmune diseases after a period of time. Any truth in that?
I haven't seen any data that's talking about like mRNA vaccines having adverse effects down the line of autoimmune diseases. I mean, it's using your immune system in a way that a bunch of other vaccines have in training your body to make a particular, protein that blocks this particular virus. There's nothing that is showing us that there's going to be long-term effects that increase that particular risk with autoimmune issues.
Okay. Someone asks, I took my last Moderna dose on March 25th, and I am still feeling not 100%. Is that normal?
Okay, so my question to that person is, did they go to visit? Did they see the provider, number one? Because usually after 24 to 48 hours, usually it goes away. Now, some people, individuals are different. Your body mechanism is different. Everybody's unique. And so you're going to have some people where it lingers, right? But I wouldn't be concerned. I would not be concerned after the second shot and you have a little fatigue, a little muscle ache. But of course, if it gets worse, if you're not, for instance, you have relentless high fevers of 104, and so forth, and it's going on, and of course that's a concern. Other than that, I don't think that's a concern at all. I think you should be okay. Dr. Clayborne, what do you think? I
Yeah,
mean,
so,
is it
first of all, talk to your doctor.
doctor?
That's a
Yeah,
little bit longer than we would expect. But
yeah,
my mother-in-law had a really prolonged course to Moderna in particular.
yeah.
She has bad allergies and it took her a while to bounce back. It's not outside the realm of possibility, but you should be slowly getting better. If you feel like you're getting worse and worse and worse, that's more alarming. But if you're just taking a long time, I wouldn't panic. I would just reach out to your primary care doctor.
Oops. Okay. So someone wanted to ask about how COVID has provoked a surge in mental health issues.
It's interesting because I don't know, someone asked a question about the children in the school and they talked about, I think, being depressed or something. Unfortunately, yes, with COVID-19, some patients actually experience depression. Um, I know quite a couple of patients who had COVID-19 who are actually seeing someone for depression. Um, some of it varies. It lasts for sometimes 3 months, sometimes it goes up to 6 months. But again, please speak to your doctor. Please get counseling. Please seek help because it's very sad. But I have seen quite a few patients who are extremely depressed and they have panic attacks and they're frightened and you can't blame them, but you have to be the voice of reason for them and also talk to them about getting help and seeking the help that they need. For my students, I always refer them to our wellness center and try to get help for them and counseling. So please, that's a big issue, right? And please do not sit lightly on that. Please get help and get the counseling that for you or your kids. It's very, very important. Yeah, thanks.
Okay. All right. So this is the last one. So Christian wants to know, can you mention some of the platforms that provide us with information to get the vaccine?
There's a lot of different, so each state is going to have a different platform. Someone in New York might know what the platform in New York is, or perhaps Dr. Hendrickson can send out the registration kind of site, central site. I know in Maryland, we have a central site that lists like where you can get a vaccine. But if you're just looking nationally, cdc.gov is going to have like links to all the state websites where you should be able to get vaccinated. Most states will have a central registry where there's mass vaccination places, and then it's a little bit more scattered as far as where you can get into clinics, or sometimes churches do pop-ups, and you have to kind of get community engagement. But I think this would be a good one to, like, maybe have a follow-up email sent out to participants about where to get information, because I think, at the end of the day, we're encouraging you all to get vaccinated, so we want to make sure you get the information you need to take that step. So hopefully we can follow up with that. But I would just Google, like,
Yeah.
COVID vaccine, like, where can I get it? And most of the time you'll stumble upon information of where to register. And what you're trying to do is register to become eligible for a vaccine. And then they usually will email you when a slot becomes available, so you can go and get in line or get an appointment.
Yes, just go to cdc.gov, and then once you go in, and they're going to give you the different states and the locations, and exactly what Dr. Clayborne said. You're going to ask a few questions, your age, gender, stuff like that, and then you get an email. It's very simple and very, very easy. Just go to cdc.gov and then just said, where can I get vaccinated, like Dr. Clayborne did? Because that's what I actually did, and I filled it out, and that's how I got it. So very simple. Yeah.
Okay, that's it.
All right.
Thank you.
And thank you, Dr. Jenkins, for managing the chat and also for your work behind the scenes, and also asking those questions to our panelists. So we wish that we can continue on with this, as we have lots of issues that we have not yet touched on. This is also part of the Black Lives Matter Summit, which is to say that there's so much that we could have gone into regarding public health and racism, discrimination, the history and legacies. That's by itself. Yet at the same time, in the spirit of activism, the purpose is to help people. And that is what that movement and this moment is about, trying to give you direct information to empower. Now, we know that we couldn't get to every single thing, but we do want to leave you with some resources for you. First and foremost, we want to thank our panelists for the time that they've offered to us. And so if you want to follow up with a question or follow them, Professor Faith Armstrong, we were joking earlier, she is free from social media and does not have that burden. And so I'm a bit jealous, but you can find her and contact her electronically via email at that address provided under her name. Dr. Jasmine Bihm, you can follow her at Jasmine Bihm on Twitter. And you can also follow Dr. Liz Clayborne, Dr. E. Liz PC. Also, as mentioned, there was some question about where to get vaccinations. I will share that for me, this was helpful to find my vaccination. I got the Moderna shot. And on Twitter, I simply followed these handles, which give real-time updates when slots are available. If you are looking for the vaccine, if you are looking to get vaccinated and are having problems. So if you have Twitter, or if you even just search online for these will post updates and where, and kind of links to join. To sign up for an appointment. They go by borough, and again, that's how I was able to find mine. So again, we wish that there was much more that we could get to. You can feel free to follow up with our panelists, and I would also like to share with you the upcoming events that we have for the Black Lives Matter Summit. If you already have not, please register for the events we have upcoming. Those include tomorrow, where we will talk more from a student perspective in our forum, Student Voices Matter. Where do we go from here? That will be tomorrow at 3:25. And on Thursday, we will talk more about the legal aspect. Knowledge is power. So you think you know your rights. That'll also be Thursday at 3:25. The RSVP link is there, and you can find that by going to laguardia.edu/BLM Summit. So with that being said, we really are grateful to our panelists. Let's give it up for them in the chat. Just put a little bit of thank yous and so forth, which is about as close to applause as we can get these days. We are very grateful for your time. We know that you're very busy, but also in the spirit of mental health and Zoom fatigue, we want to be respectful of your time. But most importantly, please be safe. Please be vigilant. This is not over. This is an issue that affects our communities, and we have to adopt the community ethos of our ancestors who looked out not just for the individual, but for each other. And so even if you're good, you have to make sure that your neighbor's good, that your mama's good, right? Are there any final words that our panelists would like to leave us? I'll defer to each of you to say a quick 10, 20 seconds to leave our to leave our audience with before we adjourn for the evening. Anyone want to start?
I just wanted to thank you, Jason, for organizing this. I thought it was a great event. I always enjoy being able to speak specifically to my people because, that's who I think we need to be talking to. Like I definitely am cognizant that I operate from a position of privilege. I have a lot of information and a lot of access that a lot of people don't have. And my cell phone blows up with these questions all the time from my friends and family members. So I love the opportunity to be able to share that with other people. And so hopefully, I said something that kind of, touched you today. If you have follow-up questions, reach out to me on social media. And just encourage you guys to do what you can to protect yourself and your family because you're the number one in that and no one else is going to do it for you. So thanks again for having me here. And I really enjoyed meeting virtually my co-panelists. I thought it was a great event.
Well, I just want to say thank you, Jason. That was well done. And such a great expert panelist. I mean, wow. Even I was learning while you guys were speaking. I'm like, wow, this is awesome, right? But I just want to say, let's just be the voice we want to hear. And let's just stay positive. I always say, if we cannot hear the whispers, then how are we going to attend to the screams? And so if we can just sometimes just sit back and reflect, and then do not allow our past to define who we are, because then that means you already lost the battle. And so let's not do that. Let's just be the voice we want to hear and pay attention to the whispers, because if we don't, we'll be numb to the noise. So that's all I want to say. So just thank you. It was a pleasure being here.
Wow, don't have as prophetic words as Professor Armstrong, but I do want to echo that we will get through this. We are getting through this. It's hard, but we will get through. And I just really want to thank Dr. Hendrickson for this opportunity to speak to you all. I also get questions from friends and family and feel like I don't get a chance often to share all this knowledge and information that I do have. And so I really appreciated getting to speak with you all about this really important issue. And like I said, I'm from Astoria, although I'm outside of the DC area now in Silver Spring, Maryland. I feel back home in getting to share this information with you all and try to answer your questions. So thanks for this opportunity.
All right, and thank you for those kind words, Professor Armstrong. From an English professor to you, thank you for your poetry. And I've placed the link in the chat. Please continue to be safe. We hope to see you we hope to see you in our next events. And again, thank you for coming out. All right. Good night. Be well. And again, Black Lives Matter. Take care.